grossing tutorial on how to dissect off the fat from a colon resection for colon cancer. You will need a pair of forceps with teeth over like this, and you'll need a pair of sharp scissors. These are really great because these are disposable blades, and I'd also like these because you have kind of a curved end here and then more of a pointy end right here. So let's get started. So you find one end of the specimen, and you take your forceps, and you want to get around not only the mucosa but also the muscularis propria right there. And then you're just going to basically take your scissors and start cutting close to the bowel wall. Now, I've already got started just a little bit there, and I'm already going to start using my hands because this is what I'm used to and what I usually do. You can certainly use forceps for the entire process, but you can actually kind of put your fingers underneath and push up on the muscularis propria and really get close to it with your hands. So I'm just going to continue trying to get as close as I can to the bowel wall. Now, sometimes if you have diverticula within the same segment that you had the cancer in, you may cut across those ticks. So I'm just continuing. And I like this pointy end because you can kind of like go down and then cut across like that, as opposed to the curved side, which is kind of like not pointy, and it's harder to get down. So I like to use the pointy side to get down deep. So here's the pointy side here, to get down deep into the fat, and then cut across like that. So once again, just take one end of the specimen, make sure you've got your forceps attached to the muscularis propria in the mucosa, and then you take your forceps and just kind of start dissecting this off. Obviously, it's a lot easier in the fresh state than in the fixed state. Let's go to the opposite end just so you can see me do it again. So here's the opposite end. We've got our mucosa here. We've got our muscularis propria here. This is a fairly fresh specimen. So I'm just going to take it like this, and I'm going to cut across the fat. Once you get far enough down, you can take your finger and push underneath the muscularis propria and continue cutting. That's all for now. Hi there. This is a grossing tutorial video on how to process or how to search for lymph nodes from a colon cancer case. I've already dissected off the fat from the bowel segment. I've got a portion of the fat here. I've got my cassettes here. I've got a long blade here. I've got a forceps, and I've got a scalpel blade and a scalpel blade handle. You're going to need all these things to perform the search. I've also got a container lid here full of formalin, which I'll put my lymph nodes into if I desire, if I want to. You can also put your lymph nodes in the cassettes as you go. I like to put them in a lid with formalin, and at the very end, put them into the cassettes and then dictate the cassettes. So let's get started. So what we like to do is, you can see I've already cut across this portion of fat previously, but we're going to line up the fat, and we're simply going to make 1-2 millimeter interval slices through the pericolic fat. But before we do so, we want to look at the cut surface. So I'm looking at the cut surface here, and I'm not seeing any lymph nodes, so we can go and get started. Let me go ahead and zoom in a little bit. That's better. So I'm going to cut at like 1-2 millimeter intervals, and as I do so, I smash the slices as I am cutting. And I'm also taking a quick look at the cut surfaces to see if there's any lymph nodes. And as I cut across this right here, I already see a lymph node. So there's a lymph node here, bisected, or it may end up being serially sectioned in the end. But you've got to pay attention to the slices that you make and the cut surfaces that you make. So what I can do now is stop for the moment. I can go ahead and cut out this lymph node here, okay? And the other half right here. And there we go. We got the whole lymph node. We don't want to cut across and say this is a lymph node over here and a lymph node over here. This is one bisected node. So I'm going to go ahead and place that into my cassette. It's big enough that it'll fit in the cassette and process well by itself, bisected. But then I'm going to want to smash the remainder of the fat. Make sure there's no additional lymph nodes. And then, as you go through this process, you can move the fat to a pile over here. And I'm going to go ahead and look across this again, make sure there's no additional lymph nodes. I'm going to do another section or slice of the fat. And look, I've got another lymph node right here. Actually, I've got a lymph node here, a lymph node here, and a lymph node. Those are actually vessels there. So I have one lymph node bisected. I have a second lymph node bisected. So I'm going to go and dissect those out. I've got that node here. It may actually be grossly positive. It's got kind of a nodular, firm appearance. So I'm going to cut this out. Looks like I got all of it there. So it's a little bit on the thick side. So I'm going to section that. I'm going to section that. And I'm going to go ahead and submit that into one cassette and call that a sectioned node. So as you can see, I'm kind of doing the cassette method where I'm finding these lymph nodes and putting them into the cassettes instead of into the lid full of water or formalin. So you can do that, or you can put the lymph nodes in. Actually, what you could do is you could differentially ink the lymph nodes if you want, and then combine them into one cassette. So I've also got this lymph node here. This one's pretty small. And so what I'm going to do with this one is, if you recall, the lymph node I just had at the very beginning of slicing this up, I bisected it and stuck it in this cassette right here, okay? So here's the bisected lymph node. And I can actually go and put the smaller lymph node in there as well, but what I'm going to want to do is I'm going to want to differentially ink it. So let's put some blue ink on this, okay? I'm going to throw some vinegar on top, let that vinegar act as a mordant, and let that ink stick to the lymph node. I'll let that sit there for a few seconds. And then kind of dry it off. As you can see, it's stuck to my paper towel. But now we can combine these two lymph nodes into one cassette. And just call this two bisected nodes, open parentheses, one node differential inked blue, close parentheses. And here's the other cassette, which has the sectioned node that's kind of nodular in appearance. So I've got those two cassettes. So now I just want to finish my process here and smash this fat. And you want to make sure basically when you get done with doing the whole lymph node dissection, all you should really have is little strands of fat in the end. Okay, so let's do another section and see what we find. So I'm smashing the fat, looking at the cut surface. I don't see anything. There's some clot coming out of this little vessel right here, but there's no lymph nodes, no cross sections of lymph nodes. So I'm just going to continue on with my process here, smashing the fat. I don't feel anything or see anything. I'm going to add it to my pile over here. I'm going to continue on slicing. I don't see anything. Oh, I do see a lymph node right here, but there's no other half to it, doesn't look like. So let's make sure it is a lymph node. Across it there. And actually, it's just hemorrhagic fat. So even the most experienced can be fooled. So anyways, you continue this process until you find all the lymph nodes, not just 12 of them. And what you want to do is if you do find 12 lymph nodes or less, you want to take all the dissected fat and you want to put it in a lymph node recovery solution or dissect aid overnight and then do an additional search the next day. And the reason I say this with 12 is because sometimes you can submit 12 and say, okay, well, I got them all. Or, you submit all the lymph nodes, you end up only with 12. But then in the end, the next day, there ends up only being 11 because what you thought was a lymph node ended up not being a lymph node. So it's better if you have 12 or less to submit it in dissect aid or lymph node recovery solution. And make sure you make a note in the dictation that you are submitting the dissected fat in dissect aid overnight, and an additional search will be performed. And after you perform that second dissection of the dissected fat that you already looked through, you're going to want to change your dictation once again and let them know whether you found any more. And if you did not find any more lymph nodes, we typically do 5 cassettes of the dissected fat, this stuff right here, just to kind of be thorough, or as thorough as we possibly can be. Thank you for watching.